Friday, June the 12th. That's coming up this week, of course. It includes opening up restaurants and expanding social gatherings from 5 to 10 people. Toronto and the GTA, Greater Toronto Area, not on that list. There are some other parts in Southern Ontario not on the list. Ontario is moving into stage 2 as well. Let's show you the map here just to give you a sense of how this is going to look. So as you can see, geographically anyway, the vast majority of Ontario moving into stage 2, but the big metropolitan regions of Toronto and Hamilton and down in the Windsor area, they will not be moving into phase 2, at least not yet. Let's bring in Dr. Isaac Bogoch to the conversation, an infectious disease specialist who is based in Toronto. So obviously some people will be disappointed by this. Others say, you know, this is a very smart strategy to sort of have a hybrid approach here. What's going on in Toronto is not the same thing as what's going on in Thunder Bay.
Yeah, I completely agree. I think it is a very smart approach. We know that there is a lot of cases in and around the Greater Toronto Area. This was holding the rest of the province back. Places like Kingston, Thunder Bay, Kenora have few to no cases, yet they are not allowed to operate businesses despite having an extremely low risk. So I think it took a while for Ontario to get to this point, but I'm glad they did. Places like Alberta and Quebec did something similar, and it seemed to have worked out well for them. I think it's a very reasonable option to do here in Ontario.
What's to stop people, Dr. Bogoch, though, from traveling within the province? Let's say, you are in Toronto and you decide to go to Ottawa.
Yeah, absolutely nothing. And that is certainly one of the risks. And of course, something like this has to be taken very delicately. So places still need to adhere to all the principles to prevent infection from being introduced and transmitted. That means hand hygiene, that means physical distancing, that means putting on a mask if you're in an area where there may be people clustered together that can't practice physical distancing. That means wiping down high contact surfaces in businesses, for example. So it doesn't mean that things are open and it's a free for all. Absolutely not. It just means that we can move to that next stage, and that some places are certainly more ready to do this than others.
Right. We're going to show some of the list, the places that are reopening, moving into what's known as stage 2, just for people who are watching us across Ontario who might be curious whether their own local health unit is now a part of this. We talked a little bit about, Ottawa being part of this, Chatham-Kent as well, the Eastern Ontario region, and the list goes on here. You see Ottawa there, London, Ontario, of course, big population center, Peterborough as well, and, the area in and around Belleville, and on it goes. Lots of different places as well. Now, what does it mean for the ones that are not on this list here? The Torontos and the Hamiltons, and you're laughing, but walk me through what you think.
Yeah, I mean, it's too bad. I feel so left behind, but we are. I mean, and it's fair. There's still a number of cases in these areas, and it's just not, unfortunately, likely not safe to move on to phase 2, because it could certainly exacerbate these problems. And of course, I would love for the GTA to be in the same position as these other places moving forward, but sadly, we're not there yet. I think we will be headed in that direction soon. Certainly, we see tons of steps in place to get this infection under control, with diagnostic testing, with improvements in contact tracing, with policy, public health resources really being focused on these harder hit areas. So I think we're going to see the fruits of that labor soon. And of course, the other thing too is, just because those other places are opening up a little bit more, we should not be surprised if infection, as you point out earlier, could be introduced there. So we still have to have those protections in place to prevent that from happening. And if it does happen, we also need to appreciate that this is not a linear path forward. If there's an unacceptable number of new cases in those areas, they'll probably need to clamp back down again.
Yeah, speaking of that too, I mean, there is good news. I mean, you and I have been speaking for months now about the two problem areas being Quebec and Ontario, and I'm just looking at the numbers today here on my screen. I mean, Quebec with 198 new cases today, Ontario with 243 cases. What do you make of that?
Quebec has shown a trend through time. So Quebec has certainly seen this really impressive decline in the number of new cases per day, at least for about 7 to 10 days now. It's sustained over time. To be totally fair, I'm not entirely sure how that's happening, but it looks like it's really happening, and that's just fantastic news. Toronto and the GTA certainly, we've been in the 300 to 400 new cases per day range for quite a while. It's been quite stubborn in that time, in that range. The case numbers today certainly look promising, but the key is, can we sustain this over time? I'm sort of confident that we can. I think that the steps have been taken that we will get this under control in the GTA, which will help the rest of Ontario and the rest of Canada.
Yeah, and at the same time, Dr. Bogoch, you know, the WHO noting that yesterday, Sunday, had the most number of cases in one single day, 136,000 cases. So while things are getting better in North America, Canada anyway, and in Europe, it's getting worse globally.
Yeah, that's a huge problem, because even though we might be doing well here, and I mean, everyone in Canada knows the challenges there have been and the steps taken toward getting this under control in Canada, and quite frankly, the personal sacrifices that just about every Canadian has made to help this. You know, staying at home, people have taken social and economic hits, and of course health hits, of course, to get this under control. So that raises a great point, because you know, if we just open our borders or try to get back to normal, we can certainly go back to square one if we start to import a lot of new cases. So this is going to be very challenging moving forward, just because Canada is doing well now and the rest of the world is not. And we certainly have to protect ourselves from importing cases. So it'll be very interesting to see how policy adapts to the rest of the world to keep Canadians safe.
Dr. Bogoch, always good to have you on. Happy Monday to you, and thank you for this.